Hello, ladies. This is Dr. Jennifer Sylvan, pediatric dentist here. I just wanted to go ahead and briefly cover with you all oral health care when it comes to pregnant moms and what to do with their new babies. So, before I even begin, I just wanted to kind of pinpoint a couple of things with you all. There are a number of things to go over as far as this particular topic, but I will try my best to give all the important information that you need and make sure that you understand the importance of going to the respective individuals as far as your general dentist and also your child's pediatric dentist, excuse me, in case you have any additional questions. Now, another thing that I want to say before we all start, whether or not you know the information that I'm about to share or you don't know it at all. When it comes to being a mom, you have multiple things that you have to cover and multiple things that you have to remember. So please cut yourself some slack. You're doing better than you think. Okay? So we'll go ahead and start when it comes to prenatal. Now, like I said, with all the information that I am about to share, three things that you should definitely remember throughout this presentation. Brush your teeth twice a day, floss once a day. You, mom, make sure that you are going to the dentist. Please make sure baby is going to the dentist. Okay? If you don't remember any other thing that I say throughout this presentation, brush and floss, visit the dentist. Okay, so now a couple of things when it comes to your oral health when you are pregnant. So we already know that you're going to multiple appointments, especially during the prenatal stage and perinatal stage. So your physician, your nurse, other healthcare physicians or practitioners are seeing you more than what a dentist, basically a dentist would see. So many expected mothers basically are unaware of the importance of maintaining their oral health as well as their oral health, the baby's oral health. So understand that children are 3 times more likely to get cavities if their mom has untreated cavities. Okay. So nearly 60 to 75% of pregnant women have some type of gum disease. So specifically gingivitis. So that's when, especially when you're brushing, you're flossing, you're noticing that your gums are bleeding and they're pretty much swollen and red. So that's basically from the internal changes, hormonal changes that you're going through during pregnancy. So when it comes to your oral health specifically, first and foremost, inform your dentist that you are pregnant. So this will definitely help them to make sure they have a game plan for you in case you do have untreated cavities. So that way they can properly, excuse me, spread out your treatment throughout the course of your pregnancy. So, like I said in the beginning, make sure that you establish a dental home prior to becoming pregnant. So that's the best way, honestly, to make sure that you are in constant contact with a dentist. As far as obtaining any type of treatment, whether that's a filling or a root canal or possibly an extraction or getting a tooth taken out, the ideal time to go is usually during your second trimester. So it is safe to get dental treatment throughout your pregnancy, but second trimester is ideal. So within this particular trimester, you're not as at risk for complications, for fetal complications, and you're less uncomfortable during the second trimester. So basically taking the step to make sure that you're ensuring that dental infections and other complications are not exacerbating by the time you go into your third trimester. Okay. Now, at this particular appointment, make sure that you are bringing a pillow or a blanket. And so, when you are sitting in the dental chair, kind of roll up the blanket or put the pillow behind you underneath your right hip so that you're leaning more towards the left side. and that'll kind of help with any symptoms of hypertension when you're sitting in the chair for a lengthy amount of time, especially if you're enduring treatment such as a root canal or fillings on multiple teeth. Okay, so then keep in mind, as I stated, in the first trimester, it can be risky due to complications that can occur early in fetal development. However, routine dental exams, cleanings, and overall maintenance should not be avoided. In the third trimester, like I said, it is not ideal and it is uncomfortable. By this time, the mother is considered to be or to have a full stomach due to gastric emptying, like delayed gastric emptying. So, therefore, you're more at risk of aspirating, especially with like symptoms like GERD or any type of acid reflux or even nausea and vomiting. So, even though there is an ideal time to get dental treatment, with all of the fears and underlying complications that you think may happen, the consequences of not getting treated for active infections during pregnancy outweigh the possible risks presented by most of, that should say of, excuse me, medications required for dental care. So, a lot of mothers do ask this question, especially if they are expecting mothers who are bringing in their toddlers or other children. Is it safe for them specifically to get dental x rays when they visit the dentist? And I say absolutely yes, especially now with newer interventions and technology. We definitely have the use of a lead apron. So, you definitely want to ask your general dentist to supply you with a lead apron as well as a thyroid guard to make sure that the sensitive tissues, underlying tissues, are not being radiated. So I believe you all have covered this in regards to nutrition and things that you need to be eating throughout your pregnancy. So I say this to all of my parents, for themselves and for their children, to make sure that they have a balanced diet. So you want to avoid anything that has high sugars in them. You want to avoid beverages that have high sugar, like juice, fruit flavored drinks, and sodas, and you want to turn to more healthier foods that are beneficial for your teeth. So, foods like cheese, veggies, nuts, and lean proteins are good choices. If you have nausea, eat small amounts of food throughout the day, healthy foods throughout the day. Let me make sure I say that. And you also want to drink fluoridated water throughout the day, especially between meals. And that fluoride will kind of help to remineralize your teeth, especially when they're soft. As far as oral conditions go, there are a few. So, some that you are familiar with, and others that might seem scary, but they're really not. So, I want you to know that everything that you're about to see is definitely treatable. So, that's why it is very important that you are under the care of a dentist. So, the first thing we're all familiar with is basically a cavity. So, with morning sickness and a lot of the gastric reflux, you're going to start to have more an acidic environment within your mouth. So that's causing the bacteria to have more of a favorable chance to grow and especially to start to break away at your teeth. In addition to that, if you're frequently snacking on sugary foods, that's going to cause cavities to form even more. So you want to make sure that you are drinking fluoridated water, and you want to make sure that you're brushing twice a day with the fluoride toothpaste, and to also make sure that you're flossing as well. So not drinking fluoridated water, and also decreasing the attention of your overall health, overall oral health is definitely not uh, going to help with this particular problem. Then you have pregnancy gingivitis. So this is the most common oral concern when it comes to expectant mothers. So basically, this is just an inflammatory response. Like I said before, when it comes to your hormone levels, your body is trying to manage everything that's going on within that 9 month period to make sure that baby is getting all of what they need. And of course, the undue stress of what's going on with your body. So, like I said before, this particular condition can be reversed with proper brushing and flossing habits. Now, periodontal disease is a little bit more beyond what gingivitis is. So, it's an aggressive form or untreated gingivitis, basically. So, now it's going deeper down into your gum tissue where the bacteria is basically breaking down the bone structure underneath your gums, as well as causing that inflammation, bleeding, and redness of your gums. So now in this particular case, this is where you may want to consult with your dentist to see if you need to get a deep cleaning as opposed to just a standard regular cleaning. So in this condition as well, you'll start to see maybe your teeth are kind of shifting or they're more what we call mobile. So basically your teeth are moving. And that's because of what I said prior with the bacteria sitting underneath your gums. It is eating away at your bones. So your teeth don't have a strong anchor to sit in. The next condition is called pyogenic granuloma, also known as a pregnancy tumor, but we already know the word tumor is not ever, ever, ever considered to be favorable or something that's not as scary. So we definitely use a longer scientific word of pyogenic granuloma. So it is a benign vascular lesion. So it only really occurs in 5% of pregnancies. So this particular lesion basically comes from the heightened, cellular responses within your body, especially when it comes to bacteria that's deep within the gums. So you'll start to see this growth in between the teeth. And so it kind of has this spongy feeling to it, where it appears to be a pimple on your gums. So this is definitely different from a dental abscess. So the best way for you to know what the difference is to make sure you consult with your dentist. So this usually occurs within the second and third trimester. So that's why it is beneficial for you to visit the dentist throughout your pregnancy. And just know something like this can be resolved. So basically, it'll shrink once you have delivered, with also proper oral hygiene as well. And the last thing is what we call perimyelitis. That's basically erosion of your teeth. So when you have morning sickness, all of the gastric reflux that kind of erodes the back portion of your teeth. So it'll kind of feel more like this smoother feeling. It's not as, rigid, or it doesn't have as many like humps and bumps behind your teeth. That's because the acid is kind of eating away at that. And so when you have this particular case, and especially instances where you feel like your nausea and vomiting is a bit excessive, you may want to rinse out with fluoridated water, or you can do a half teaspoon of baking soda dissolved in a cup of water, and kind of swish with that. You want to prolong brushing, so you want to wait at least an hour after vomiting to brush your teeth, just to make sure that your mouth is at the point where it's fully neutralized before brushing, because the bristles and sometimes the toothpaste has these little abrasives in there, and they can kind of eat away at your teeth, especially when it's in this sensitive state as is. So you want to make sure that your mouth is recovered as far as the pH before you brush. And so I know a lot of women do hate the taste of toothpaste when they're pregnant. And so I highly do recommend searching for a unflavored toothpaste. Ora Nurse is one of the ones that I recommend to expectant moms, and you want to make sure that it at least has the fluoride component in it. And so I don't want you guys to feel as if, the taste of toothpaste is really bad to the point where you're throwing up every single morning. Please make sure you remember that brushing your teeth is highly important, especially in this sensitive time. So if you feel like your toothpaste is causing you to have more morning sickness, then switch to one that doesn't have flavor. The same way that you switch your foods because certain ones don't agree with you, you can switch your toothpaste type as well. So the other thing you can also do is switch to a smaller brush. Just make sure it's a soft bristle brush if the adult toothbrush kind of causes you to gag. So takeaway points from this particular section, just make sure that you floss and you brush. So the order that I usually tell people is to floss first and then brush, because if you think about, when you're cleaning up, you want to make sure that you're dusting the counters first before you vacuum, because then if you vacuum first and you dust the counter, then all of the dust ends up going back onto the floor and you have to vacuum again. So it's essentially the same as when you're flossing and you're brushing. At least that's how I make sure that people are flossing first before they brush. So try to see if that can kind of help with the order so you don't forget to floss. So eating healthy foods, you want to make sure that you're doing that. And stress, stress, stress. I'll probably say this like 20 times throughout the presentation. Visit the dentist regularly. The other thing that you want to do is make sure that you're practicing healthy behaviors. So you want to make sure you're attending your prenatal classes, quit certain, vices such as smoking or drinking, and to also take your proper prenatal supplements and vitamins. So moving on to perinatal. So now with this particular stage, I'm only going to focus more on things that you will see with new baby. That's the term I'm going to use, by the way, guys, new baby. So, so these are certain things that you're going to see with new baby. Now, I don't want you to be alarmed. This is not with every baby, okay? So it's very rare that you will see some of these things, but I don't want you to be surprised if you do see these things, okay? So, natal teeth. So, you may hear some stories of other moms saying, yes, my baby was born with teeth, and they're probably not lying. So, with natal teeth, these are teeth that are present at birth. Okay, as soon as baby pops out, you're asking the nurse, like, hey, baby's healthy, all of that. And they're like, your baby has teeth. So, these are natal teeth. Okay, so majority of the time, these are their natural teeth that have just come out early. So it's rare that they're extra teeth. So you may want to consult with your pediatric dentist just to make sure that they're not extra teeth and to figure out a route of treatment. Okay. Majority of the time, you are going to see them on the lower jaw. And we'll talk about what we need to do in order to take care of this. Now, neonatal teeth are completely different. Same thing, but different as far as the time frame. So, neonatal teeth will come within the first 30 days of life. Okay, so they may pop up on day 3, it may pop up on week 2. So, you never know. So, just, look out and keep a good appraisal of baby's mouth, new baby's mouth, and kind of see what new things may pop up or what certain things that you're seeing in their mouth. So the same as natal teeth, majority of the time you're going to see it on the bottom. Now, when it comes to neonatal teeth, and also with natal teeth as well, but you see it more with this particular set, there is a specific disease, for lack of a better word, that is associated with it, and it's called Riga fidi. Okay, so that basically means as baby is breastfeeding or just the constant movement of their tongue, underneath their tongue tends to get ulcered because of the sharpness of those neonatal or natal teeth. So you kind of see it more exacerbated or worsened when baby is breastfeeding due to the backward and forward motion of their tongue. Treatment for this particular lesion is only to monitor and to make sure that it gets better. There's a certain other step that we're gonna have to take. Okay, so I just want everybody to breathe before I go into this next part because I don't want you to feel like new baby is gonna get hurt or anything like that. Okay, so we do this at least, I want to say maybe twice a year. So we're very well aware and we can definitely take care of this particular situation. So the pediatric dentist will kind of walk everything with you, like step by step, and kind of let you know certain things to expect. So, what to do, what to do. First and foremost, what I always say, visit your local pediatric dentist, okay? So that way you all can formulate a plan to see how we can go ahead and move forward to take care of this particular condition, okay? So now, so the treatment definitely depends on the movement of the teeth. So how loose these particular new teeth are. Because baby is still developing, they don't have the anchorage and the strong enough bone structure to hold these teeth in. So they're basically just floating around in the gum tissue. So you'll probably notice if you kind of, do the movement of their teeth, it looks as if the teeth are like about to come out. So that is where we have a cause of concern because especially when you're breastfeeding or you're bottle feeding, while they're doing the suckling motion, the teeth may come loose and baby may swallow the teeth. Okay, not saying choking, but they may swallow the teeth. Okay, so we want to avoid that. So your pediatric dentist may recommend that the teeth be extracted or taken out. In this particular process, the baby doesn't have to be numb just because of how loose it is in the gum tissue. And then at that point, once the teeth are removed, then you'll start to see that lesion underneath their tongue resolves and heal over time. Okay. So in this particular appointment, your pediatric dentist will probably tell you to bring a blanket for baby, and there'll be a particular position in which you will kind of help out and you will sit facing the pediatric dentist with baby in between your respective laps. And then at that point, the procedure will be done. By the time the dentist counts to 10, the procedure will be over. Okay, so take solace in that. Tongue tie. So there's also a term called ankyloglossia, very long word, basically meaning exactly what I said, tongue tied. So this is more of like a developmental thing to where the tongue doesn't detach at some point in the fetal stage, and you have that small anchorage of that tissue tethered between the gums and the tongue itself. Okay, so the major concerns with this particular condition is breastfeeding, speech, okay, especially for those who speak another language, let's say Spanish, for example. So if you have to roll your R's, and as baby is growing and they're not able to roll their R's, you may want to suspect a tongue tie. There are sometimes breastfeeding is not an issue, but then speech becomes the issue later on in life. And then there are other cases where breastfeeding is the initial issue, and honestly, that's where it definitely needs to be taken care of. So you want to consult with your pediatrician or your pediatric dentist for a procedure, what we called a frenectomy. So that basically means that baby's tongue is pushed back a little bit very gently, and there is a numbing cream that is placed underneath their tongue, right where that tissue is attached. And then, same thing, by the time your pediatric dentist or physician counts to 10, the procedure is done. So they would basically slit that little tissue piece, either with a standard scalpel or blade, or newer technology to do it with a laser, okay? Don't even Google that. I don't want you to Google it, and I don't want you to be worried. I just want you to be aware, okay? Right. So, with the breastfeeding complications, with this top picture, you can kind of see the normal tongue position that kind of helps for the lip to sit underneath mommy's nipple on the breast and to also allow the tongue muscles to uh, aid with the ease of milk, being poured out, so they can go ahead and drink. Now, when it comes to the tongue tied aspect, you can see how the tongue muscles aren't able to anchor in that position to allow for optimal suckling. So at that point, baby's issue is, malnutrition. Mommy's issue may be mastitis just because she's not able to release milk. So as soon as new baby comes out, we want to make sure that we're consulting with the lactation consultant, just because we want to make sure that that's not an issue, that baby's able to latch really well. And I know you've probably gone over this already, but that can be something you all are looking for when you're going through your lactation consultation. So this is a case that I worked on. So this is a 17-day-old female patient where mom was having issues with breastfeeding. Baby wasn't latching, and she was so pro breastfeeding, which I am all about. And so she really wanted to make sure that she basically exhausted all options before she decided to go with bottle feeding. So with this procedure, it's more of the preparation that takes a long time, paperwork and swaddling baby, getting all of the equipment together, and then the procedure itself took less than a minute. And then baby was able to feed immediately after the procedure was done. So you can kind of see the difference in the before and after. And then with a procedure like this, you have to make sure you do tongue exercises, just to make sure baby's tongue is being lifted and moving in all directions. Okay. So after everything is said and done, you've given birth, yay, make sure that you are taking care of you as well with all the responsibilities that you have, whether this is your first baby or baby number 2, number 5, make sure you are taking care of you. So be sure to go to your dentist after giving birth. You don't have to rush, but if you are in pain, you may want to go immediately. If you notice something, go immediately, okay? But give yourself the proper time to heal before, having to rush to go to the dentist. So you may want to go ahead and get those cavities filled that you couldn't get filled prior to giving birth, whether it's because of fear or because of lack of access to care. There are some dentists that don't like to treat pregnant moms, so just be well aware of that. Okay, so postnatal and infant oral health. So this is where the information can be a little bit more jam-packed. So I'm only going to give you little nuggets that I really feel like you need to know. Anything else, definitely consult with your pediatric dentist, and they're going to go over a wide range of information with you. So I would rather not kind of bombard you with that. Normally, when I have first baby visits, in my office, it usually takes about an hour just because of the amount of questions and the things that we need to go over so that mommy kind of is well aware of what's going on, as well as daddy as well. So that way there are certain things that they're looking out for. So, fun fact, did you know that babies are not born with the cavity causing bacteria in their mouth? Majority of the time, we're getting it or they're getting it from certain habits that are happening throughout life. In particularly, something that we call vertical transmission. So this is where the baby is getting the bacteria causing or cavity causing bacteria from from their moms and or from their dads or from grandparents, whomever is the primary caregiver. So basically they're passing on those cavity causing bacteria. So we've already known, we've seen this before in this picture. I know it's something culturally for me with a Haitian background that, moms, if a pacifier falls on the floor, she's cleaning it with her mouth and then putting it back in baby's mouth. So culturally speaking, I feel like that happens a lot. Sharing spoons, whether mommy is tasting the food first before giving it to baby, or mommy is pre-chewing food. There are some instances where people pre-chew the food to kind of mash it up a little bit more for baby and then putting it in baby's mouth, not realizing the bacteria that's in mommy's mouth is being passed on to baby. So this is even before baby even gets any teeth in their mouth. So now the bacteria is kind of sitting onto their gums and in the little tiny crevices of their tongue as well. So this is like an example of like pre-tasting or pre-chewing food, and then from mouth to mouth, some moms give their baby the food that way. The other way is called horizontal transmission, and that's usually something that would happen like in daycares or playgrounds where it's between, members of the same age or amongst siblings in similar age or close in age. All right, so what to do before baby has teeth? So you want to begin soon after birth to clean their gums and wipe their tongue with a clean washcloth. So this is very, very important after feeding. Otherwise, you get like this, layer of milk sitting on their tongue. Even a bottle of water afterwards may not optimally remove the film of milk. Whether that is breast milk or that is formula, it's still going to sit on their tongue and it will cause the same issues, okay, if not taken care of immediately. So the other thing is you do not want to put baby to bed with a bottle of milk or juice. So typically you would want to wean baby off the bottle between 12 and 14 months. I know it may be hard for some parents, so give yourself some grace when it comes to that. So I always get this question of whether or not breast milk causes cavities. So the simple answer is no. So breast milk alone does not cause cavities, okay? However, allowing baby to feed in the middle of the night whenever they want to, especially once the first baby tooth comes in, that gives them more of a potential to get cavities just because nobody wants to wake up in the middle of the night to wipe baby's mouth or anything like that because you're both tired. So what ends up happening, baby falls off the breast and then they roll over and they fall asleep. Both of you guys are falling asleep throughout the night and your body is more active in the middle of the night, and then bacteria is going haywire and it's starting to eat away at those new teeth. So I strongly encourage moms to see if they can maybe change the scheduling as far as breastfeeding, or just don't uh, allow baby to kind of suckle in the middle of the night. Maybe use a bottle where you're kind of having to be awake and then able to wipe baby's mouth after, or just use water, honestly. If it's more of like a comfort for them to just suckle as opposed to actually gain something to be nutritious, then at least try like a bottle of water. That way that can help soothe them to help them to fall asleep. Okay, so when to go to the dentist. So I always reiterate to moms and dads, first visit by first tooth or by first birthday. So that's something easy to remember. So by first tooth, which is usually around the first 6 months or within the first 6 months. So either 5 to 6 months or to 7. is when you'll start to see the first set of teeth, and it's usually down on the bottom in the middle, okay? Don't want to wait any more than 12 months of age. Okay, by that time, there's probably other things that's going on that's being undetected, and you want to make sure that your pediatric dentist is well aware of what's happening, as well as certain habits that are happening that may not be beneficial for new babies' teeth. Okay, so after teeth come in, so at this point, you want to start brushing and flossing. Yes, flossing. Okay, I do tend to notice that there is some plaque buildup, hard plaque buildup, even on baby teeth. With the first set, I start to see it just because flossing is not at the forefront. We automatically think of brushing, but we forget about flossing. So once the teeth come in, you want to start brushing twice a day. For kids who are under 3, you want to use a smear amount, which is more of a rice grain amount. And then for kids 3 and over, you want to use a pea-sized amount. Even for us as adults, we are good with a pea-size amount as well. The S shape, amount that you see on toothpaste commercials, that is not recommended. That is way too much toothpaste on a toothbrush. Okay, so we even as adults can use a pea-sized amount. All right. The other thing, you want to avoid giving your child foods and snacks that contain high amounts of sugar. And then also, children should not have fruit juice during their first year. I know, I had fruit juice as well. So, but I do definitely tell parents by the age of, let's say, 3 to 4, babies shouldn't have no more than 4 ounces of juice per day. Even if you water it down, it should still be 4 ounces of juice throughout the day. I would say you want to give it to them in that one sitting as opposed to have them using a sippy cup throughout the day with the same juice that you probably put in there at 11 a.m. Okay. And then after that would be no more than 6 ounces of juice, period, throughout the day. As far as like 5 and 6 and above. So, yeah. So, brushing tips. Now, I know this young lady that's pictured is a little bit older, but this is the position that I kind of want you guys to imagine. So, you want to use a small child size toothbrush, okay? No adult toothbrushes for babies. So, they shouldn't have adult toothbrushes until maybe about 7 or 8. That's when at least the front 4 adult teeth, top and bottom, are in, as well as the adult teeth in the back. Okay, so at least switch them up when they get to age 7 or 8, so that way they have an adequate toothbrush size head. So now, small child-sized toothbrush, you want to lay baby down on the floor or some place that's comfortable. If they're tinier, then on the changing table. And then you want to be at the position of their head. So that way their lips are kind of fighting gravity just a bit. And they're able to kind of relax their jaw and open for you. And you're able to kind of see a bit better in their mouth to be able to brush. Now, when you position yourself at baby's head, you want to go ahead and lift up their lip, okay? This is a problem area for a lot of parents that I'm noticing. You want to make sure when you lift up their lip, you're able to brush their gum line as well, because food, whether it's breast milk or formula, tends to accumulate in that area. And then you start to see white spots, which you'll see on the next slide. And that's a usual indication that a cavity is starting to form. So when you lift up the lip, make sure that you're brushing. Even if they only have 4 teeth in their mouth, just brush with adequate time, enough to get baby used to the feeling of that brushing sensation. Okay, you want to brush 2 to 3 teeth at a time. Sing your favorite song, whatever it may be, give them their favorite toy to kind of keep them distracted so that way you can brush better. If it needs to be a two-man job, you're going to have the other person at baby's feet. So baby's feet will kind of be underneath second person's armpits, and then they're going to hold their hands for you. That way you can hold their head and brush at the same time. And so this is the problem area where we can kind of see the early starts of cavities. So it ends up being this chalky white color. And then you'll notice even after the teeth fully come in, when you're brushing, you're still bleeding a little bit just because the plaque is kind of accumulating next to their gums. So lifting the lip is very important. So if you're not doing that and you kind of see something, whether it's with your other children or your cousin or whoever it may be, start practicing with them and kind of seeing how you can perfect your technique. Okay, so teething. So normal signs of teething, it's gonna happen unless you're one of the lucky parents that have never gone through this before, or you will be a lucky parent. Just be aware, okay? So irritability is a sign as well, excessive drooling, chewing on objects. So with the excessive drooling, especially a baby's mouth is not being wiped right away, you'll start to see little rashes around their lips. Sometimes it can go extended along their cheek as well. There's only been super worst cases where I've seen it on their chest or on their arms because they're using their arms to kind of chew a bit. So if you see those particular signs, then you may want to consult with your pediatrician if it extends beyond the lips. Okay, you also have loss of appetite and trouble sleeping. And these are normal signs, okay? You will also have a sign of like a low grade fever, but when we're going into the abnormal signs, a high grade fever, so anything above 101, that's abnormal, okay? A rash that's beyond the mouth, abnormal. Diarrhea, abnormal. Vomiting, abnormal, okay? So these are signs where you want to consult with your pediatrician to see if there is something else you can do outside of what the dentist is recommending. And so here are some tips that I have for new mommies or even, pro mommies. So you may want to massage baby's gums. So chamomile tea, whether it's lukewarm or room temperature, it kind of helps with soothing the sore gums. You may want to use a cool washcloth, chilled spoon, or cold solid teething rings. Frozen vegetables and fruits are amazing. Popsicles, they're on the high list of everything. That's one of like the top things that I recommend for babies that are teething. One of the ones that I do recommend is Pedialyte freezer pops, especially with that, having the electrolytes that's needed to replenish baby's body, especially with the drooling, especially if they end up having diarrhea or they end up vomiting, at least that can help to balance out their electrolytes. You can also find, if you can, sugar-free popsicles, so that way they're not consuming a lot of sugar. So one of the things that parents always tell me that they're using is Orajel, even if it has like baby written on it. I tell them no, to stop using it. Just because there is a particular ingredient that's in there that's not really good for a baby's bloodstream. Definitely don't want you to use an excessive amount, and then that becomes an issue. So I do tell parents to stay away from Orajel or anything like it. Don't use anything as far as teething rings that are liquid filled or gel filled, just because they may end up getting punctured and babies kind of swallowing that fluid filled component. So you don't want to use amber necklaces or any small toys or objects as teethers due to choking hazards, okay? And the best way to stay ahead of the game is basically to know when baby's teeth are supposed to come in. So the first set of teeth, I know it's a wide range that you're seeing here, but some kids, for lack of a better word, are more delayed than others. So you may start to see the first tooth at 6 months, or you may see it at 8 months. So just at least know the sequence, which is why it's very important for you to visit your pediatric dentist so that they can at least tell you or give you some solace as to not worry if your child is a little dentally delayed. Okay, so just know the two on the bottom in the middle are the first ones to come in. Then we go back up to the top, then back down to the sides, and then back up to the sides. And then you'll start to see the shark teeth come in. If not the shark teeth, then you'll see the first baby molars come in, and then the shark teeth will come in. All right. And then you'll have the very last ones all the way in the back. So by the age of 3 or so is when baby will have the full set of 20 teeth. Okay? All right. So any questions? If you do have any questions, this is my email address, or you can find me on Instagram at that handle. So Dr._JJSDDS. And yeah, I can answer any and every question. I'll be happy to. Feel free, as many questions as you have, I am happy to answer. You can inbox me or DM me, however you want to get in contact with me. Thank you for letting me be with you this evening or this afternoon or whenever it is that you are watching this. It was a pleasure sharing my knowledge. There's so much more to share, but feel free, like I said, to ask whatever questions you need, and I am at your service. Thank you.